Hello, my name is Dr. Elizabeth Dowers. I'm a physician leader at PACE Southeast Michigan's East Point Center. I am a board-certified doctor of osteopathic medicine and a fellow at the American College of Emergency Physicians. Like many of my colleagues at PACE Southeast Michigan, I have a passion for helping older adults live with independence and dignity. Many of the participants in our program have type 2 diabetes. This is a very common chronic disease. The Center for Disease Control estimates that around 35 million Americans have it. Our team at PACE Southeast Michigan does everything we can to help people manage the symptoms that come with this disease. Diabetes affects your body's ability to make insulin, which it needs to help digest things like carbohydrates and sugar. When someone has diabetes and is having trouble making insulin, they can experience really high or really low blood sugars. This can lead to many medical problems, from increased appetite to dangerous things like multi-organ failure. The difference between type 1 and type 2 diabetes comes down to genetics and lifestyle. People that have type 1 diabetes don't have the ability to make insulin, whereas people with type 2 diabetes lose the ability over time due to lifestyle and risk factors they might have. Being overweight, having high blood pressure, family history, race or ethnicity, age, and having heart or kidney disease are all risk factors for type 2 diabetes. When someone is developing type 2 diabetes, they might experience symptoms like needing to urinate more often, having increased thirst or appetite, becoming tired or dizzy a lot, having sores or infections, or experiencing numbness in their hands or their feet. All of these are signals that it might be time to see a doctor and get tested for type 2 diabetes. Finding out you or someone you love has type 2 diabetes can be scary, but I always remind my patients that this disease doesn't have to turn their life upside down. Making simple adjustments and lifestyle changes can have a big impact on a person's ability to manage diabetes. Even when someone has a more serious case that requires medication, I always recommend things like modified diet and increased exercise as the main treatment. One of the best ways to combat diabetes symptoms and help your body regulate itself is to get enough exercise. Now, this doesn't mean you have to go out and run a marathon. Simple things like stretching, doing your own housekeeping, taking walks, or practicing yoga can all be good forms of exercise. Personally, I like bowling. I encourage my patients to find ways that they can stay active while also doing something they enjoy. Another great way to manage diabetes and your body's blood sugar level is adjusting your daily diet. For instance, switching out a few sugary or carb-heavy items with fruit, vegetables, whole grains like oatmeal, and lean proteins like chicken or fish. You can still eat things you love while making a few swaps. For instance, I recommend people order a salad or sweet potato fries to go with a burger instead of ordering regular French fries. At the end of the day, small changes can have big results when managing type 2 diabetes. All you need to do is be consistent. With support from loved ones and our team here at PACE Southeast Michigan, we make sure our participants have all the tools they need. Our interdisciplinary team collaborates to make individualized care plans for all of our participants. For those with diabetes, our pharmacist, our rehab team, and registered dietitians partner with our primary care team to create solutions that work for them and their goals. Together, we help our seniors live their lives to the fullest extent possible, no matter what chronic challenges they may be facing. To learn more about PACE Southeast Michigan or to contact one of our centers, call us at 855-445-4554 or visit our website www.pacesemi.org.